Well, good morning, John.
Top of the morning to you.
It's great to be with you, and I really appreciate you taking the time to tell us about your leadership initiatives, or at least some of them at the Comet. Let's begin by you telling us a bit about your background in public transportation and about the Comet.
Definitely. I've been working in public transportation for the past 20 years as a transit manager or director for various transit systems across the country. I got my passion for public transit at age 5, seeing buses go by while living in San Jose, California. And,
5? Well, that's a long love affair with transit.
It sure is. I thank the buses in San Jose at the Santa Clara Valley Transportation Authority for that. I even got my start working in public transit, doing high school internships at age 13, working at VTA and San Francisco Muni and a few other transit systems in the San Francisco Bay Area. So it helped give me the necessary experience to be where I am today. And over the course of the past 20 years, I've been instrumental in starting new transit authorities, starting new transit systems, restructuring systems, and that experience is what brought me to the Comet in Columbia, South Carolina. They were looking to reinvigorate the brand, stabilize the funding sources, and find ways to be more efficient in how we move people in the Central Midlands, basically becoming more of a mobility agency versus just a standard transit agency.
Well, tell us a bit about the Comet, ridership, the nature of your fleet, and so on.
The Comet is a transit service that provides service within Richland and Lexington counties in South Carolina. We basically serve the Columbia metropolitan area, which is the state capital. We have a fleet of 81 buses that operate between our fixed route and our paratransit system, 39 bus routes. We primarily run from 4:45 in the morning until 12 midnight. And we also provide mobility-related programs to also help move people, such as a van pool program, a partnership with Uber and Lyft, and we just recently got into bicycles. We contract out our operations to TransDev, which has been the contractor since the Comet's inception in 2002, and we have a staff of about 11 people that oversee the operations contract with TransDev.
Okay, well, thank you.
I should also add that we carry 2.8 million passenger trips a year.
Oh, okay, great. Now, I'm aware you've launched a number of mobility initiatives at Comet in recent years. What got you and your colleagues there started on what you might call the innovation route? What's the backstory on these mobility initiatives?
The backstory really goes back to funding. And the Comet is in a unique situation where we do have a dedicated sales tax, but our dedicated sales tax expires either in 22 years or when we get to 300,991,000, whichever comes first. And we were running some inefficient bus services that were not productive, and we needed to reduce our spending so that we can extend the funding source that we get from Richland County. So that's where the start of looking at creative ways to moving people came into play. And that's where our discussions with Uber and Lyft also occurred to see how can they help us in providing nighttime transportation and transportation to grocery stores at a much lower cost than traditional bus service.
Now, how did you get your board involved in coming up with the initiatives that you've launched? What role did the board play in selecting?
When I was first hired, the board expressed wanting to see more innovative ways of moving people in the Central Midlands. They understood our financial limitations, and they understood that the traditional bus just sometimes doesn't work. So the board challenged me to get creative, work with alternative modes of transportation, and then present to them options on how we can start making transit attractive and also making transit more efficient. And one of the first things that they asked me to tackle was addressing the nighttime transportation. We ended up cutting approximately $465,000 worth of nighttime bus service back in May of 2018 due to extreme low ridership at night. But there were still concerns in the community on how those people who were traveling at night would be able to get home from late night retail, entertainment, or hospital-related jobs.
So I take it your board members have been really supportive and bought into this idea of innovative approaches, new
Yes.
mobility initiatives.
Yes, they have. We started presenting the concepts at a service committee workshop where we analyzed the costs of providing these mobility type of programs, and we also analyzed the cost of using traditional bus service, and then we also analyzed the ridership data on how those traditional bus services were performing. And then I laid out each of the partnerships, which includes Uber and Lyft for the nighttime and the going to the grocery store program, the van pool program, and then the bike share programs. And as we discussed each of those innovative mobility options, we then talked about what demographic group would utilize the service, what are the pros and cons of implementing the service, the cost effectiveness of each service, and then how would it interact well with the existing transit system as a whole. And after that workshop, the board, the committee made the recommendation that these programs make financial and operational sense and recommended that to the full board, which concurred with the committee's recommendation.
Did any board members have any special concerns you had to work through, had to address?
Yes, we had about 3 board members that was particularly interested in how are we targeting the low-income market as it relates to these programs, like especially the Uber and the Lyft program, where some of the people who presently use the transit system may not know how to use a smartphone or may not have a credit card. And how we addressed that was we have a travel trainer full-time that goes out and trains people how to use the transit system, and as part of her curriculum, she's now training people on how to utilize the Uber and Lyft app. We worked with Uber and Lyft to ensure that we had the availability of not only using credit card, but using prepaid debit cards with the Visa MasterCard logo, Apple Pay, Google Pay, and gift cards, and having those readily available at retail stores so that those that are low income, that are unbanked, would be able to have access to those cards. And then 3, we went out and rode transit routes and went out to community meetings in those lower income areas to promote these options and did some demonstrations to ensure that there was a good understanding. And then even one last piece, we even partnered with Lifeline phone companies that provide cell phones to low-income residents and allowed them to set up tables within the transit center so that they could sign up people that ride the Comet to get these Lifeline phones so that they were able to start having smartphones and they can then download the Uber and Lyft app and be able to access these innovative programs.
Great. Now, why don't we drill down? You've given us the general overview, and let's describe a couple of the initiatives in some depth for us, if you would, so we really understand the mobility initiatives you've implemented. Drill down for us.
So the Uber and the Lyft program is called Comet on the Go. And within Comet on the Go, there's 2 programs, Comet at Night and Comet to the Market. Comet at Night is basically a replacement of major bus routes that were operating between 9 p.m. and 12 midnight. And what we've done is basically we provide a door-to-door type of service where a user would have to board a Comet bus route and get the code within the bus. They put that code in the Uber and Lyft app, and they can ride anywhere where we have Comet fixed route service between 9 p.m. and 3 a.m. 7 days a week. And the Comet will pay the first $5 of that trip. So if the trip falls within the $5 range, the user doesn't have to pay anything. If the trip exceeds $5, the user pays the difference. And looking at the current ridership of the program, we're seeing an average trip cost of $8, which means that users are only paying $3. On the Comet to the Market program, this one is the first in the nation where basically we subsidize the first $5 to take anybody to a grocery store that sells fresh produce and fresh meat. The Columbia metropolitan area has a lot of food deserts, and access to the grocery stores is a bit challenging utilizing the Comet fixed route system. And the first thing I heard from the community was transportation was a barrier to fresh food. So by having this partnership, we were able to provide a one-seat ride from a person's home or their employment directly to the grocery store and then back again. And we advertise that code broadly because we want to make sure that people have access to the program. And that service is available from 6 a.m. to 10 p.m. 7 days a week. We've even gone as far as geofencing every grocery store with fresh produce and fresh meat with the help of our council of government in the Uber and Lyft app, so that when people are going within the Comet fixed route service area to the grocery stores, that we're truly ensuring that those trips are going to grocery stores.
That's fascinating because that's not only a transportation initiative, that's a health and wellness initiative.
Exactly. Yes, and we even gone as far as one more other step is that we're partnering with a local nonprofit called Food Share, and we sell fresh produce at our transit center every Tuesday from 3 p.m. to 6 p.m. And people can buy a box for $15 cash or $5 with an EBT card. And that also helps those transit riders that are coming home from work that need fresh produce, and they can just simply pick up a box and take it home with them.
Well, that's certainly innovative. Could you describe another initiative before we sign off today?
Yes, this next one is an exciting one, and we're actually, we launched it in February, and we're having a press conference tomorrow on it. And that's our partnership with Columbia Blue Bike. And how Blue Bike works is it's a bike share system within downtown Columbia. There's 20 stations, 135 bicycles, and the Comet is sponsoring and funding 10 of those stations. But the positive thing about this program is that we are subsidizing Comet users to use the bike share program as a first mile, last mile extension of their trip. And simply how that program works is as long as a Comet user has a 1-day, 5-day, 7-day, 31-day, or a 10-ride pass, they would show that pass to the bus operator, and they would get a slip that has a password. They would put that password in the Blue Bike app or at a Blue Bike kiosk, and the user would get unlimited 45-minute session for the entire day. So what we've been seeing is riders are getting off the bus at our transit center, checking out a bicycle, riding a bicycle to their jobs, and then dropping off the bike at the nearest bike share station near their job. And then in the afternoon, they're checking out the bicycle, riding back to the downtown transit center, and then taking the bus to wherever they needed to go, instead of waiting for another route that may 30 minutes or having to walk. So this is kind of a way to help people get to their jobs in a much quicker manner, as well as helping promote a healthy lifestyle.
As a person who cycles frequently, I will attest to the health advantages. cycling. So now, tell us how these initiatives are paying off. What have you learned about since you started the implementation?
So with the Comet on the Go program, the initiatives have been working out exactly how I expected it to be. Our cost per trip is very low. The ridership is coming in within the expectations. Comet at night is carrying about 100 passenger trips a month right now, and the program has been in existence for 2.5 months. Comet to the market has been carrying about 250 to 300 passenger trips a month, and it continues to grow. We are seeing value as it relates to having these partnerships with Uber and Lyft just because of the cost per trip. If we were running bus service, dedicated bus service to grocery stores, or dedicated bus service at night, we will be spending approximately 50% more than what we're paying to Uber and Lyft on a per trip basis. So definitely the value of having these type of partnerships is working out. As it relates to the
I'm sorry?
I was going to say, as it relates to the Blue Bike program, the Blue Bike program is about a month in, and so far we're starting to see, as riders learn the program, we're starting to see additional transit users take advantage of checking out the bicycles. When it first started, we saw maybe about 2 or 3 a day transit users using the program. We're now seeing 25 to 35 people a day utilizing the codes. So it's definitely picking up as people learn more about how the bike program, the bike share system operates.
So you're getting a more than acceptable return on the investment.
I would say so.
As far as you and your board are concerned.
Yes, and just so that you're aware, for the Uber program and the Lyft program, we're spending collectively $150,000 between the two vendors, and for the bike share system, we're spending $70,000.
Okay. Well, John, I want to thank you for taking the time, and I know how busy you are, so I really appreciate it. To tell us what you and your Comet colleagues are doing in the area of mobility innovation in Columbia, South Carolina. Thank you so much, and have a great day.